Yes, she doesn't have. Yeah. You're not sure, right? Sue's here too. Can't sit there, no, Mike. You gotta sit with the yellow dots on. You sit with the yellow dots on. We map it out. For that yellow dot. Sit right there.
It's for 6 feet. You're in Venus. Anybody sits in there, that's where you're sitting.
Like I do.
I can't tell. That's why I'm supposed to sit. This is not 16.
Yeah, she used to sit.
Sorry, Carl. No, I'm sorry. I can't blame you. I don't recognize you.
You doing okay this morning?
Yep. You can sit right there.
No, this is a little too close. And I saw the note that said people, so I thought maybe I better up there.
Gotta get your mask on.
Did you hear that already?
Tell me about this here. Yellow dots. Okay. Get you one?
No, I can't remember. I don't have a mask for that.
Oh.
I'm more effective, so I got it. Unless there's something wrong.
I'm Bill Sampson.
I'm Carla Whiting.
Okay.
That's the fairgrounds. I don't know my hand.
No, I covered this recording with the Dell actually. That came off the cushion there yesterday. It was a long morning. We were in here 2.5.
Kind of warm.
Some, if you saw it, we sent those can get very long, especially when they have there's a thing it's called pre-sentencing.
Yeah, it's in the
They gotta look at that, put it in his situation, work out his whole plan. Yeah, guess so. I didn't see No. Especially the group that just came out.
Oh,
Are you representing the group?
yeah, kind of blind.
Oh, okay. Another Frenchman, Rory. Is that Rory?
Yeah.
Anyway. Changed, he used to be, she has that, the insurance and the billing group out there, and so check with her every day. Go by, I think that's my,
Me too.
no, that's it. I'm sure there's some other people who drive back and forth. There are a lot of people who drive back and forth. Oh, God.
Hold your hand, I guess.
Perfect, thank you.
You're fine. You're related to the
Everybody's related.
Yeah, well, that's what I'm saying. Who? Oh, okay, yeah. I used to run a store down there and used to deliver supplies up to Lima. People for the Exxon station. Stove station.
What was that, back in the 20s?
I think back 20 years ago. When I was a young man.
During the war?
Not really around that old. Well, Vietnam, I was around Vietnam, I guess that's a war. Undeclared war, but it was a war.
No, I see she's going to report to the.
So, anyway.
Where's George?
I don't think so. You put this on. I have 2 months. Thanks, sir. They said, back up there.
Look at that. JC's got their own.
I just go like this.
Did you see that?
JC Mints?
I guess
It's just,
Bill Rosie can work up anything.
don't get wrong, it's pure.
Hello? 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 This is Don Gabbard. I just wanted to make sure that I was...
Just a second, Don. I'll call roll call and let's go.
Hey, Donnie, this was the fault. I don't know if it's connected.
Mute your phone, we can.
Yeah.
They can't hear you. Need Carly to fix these things. Gotta be clicked. I don't know which button to click. I'll get Carly.
Mute your phone, we can hear you on the
I don't
conference
know, I
call.
hear people talking, so you might as well dial in, switch it over.
Jed does what everybody in
I think
court.
they can hear you.
Court about halfway through, you'll see their masks go down so they can breathe and like that.
Which button?
See, look at it. He's got, well, he raised it back.
This is way on my phone here. I'm in instructor which button to push.
There's that.
Code C.
Jim Gold, your city attorney.
Code
We're
C.
gonna turn in right now.
George didn't make it.
Now they should be able to hear us, Tom.
They'll find
Can you hear us on the phone now?
George is not here.
Yeah.
Can you hear us on the phone?
I should be here, but he's not.
I can hear you.
Okay, mute your phones for a few minutes. Mute your phones and then I'll call for the conference call.
Yeah.
Because I can hear everything, you chattering back and forth to each other. Okay, it's 11 o'clock. We'll start the Beaverhead County City Board of Health meeting for today, July 17th. And I'll start with roll call, and we'll start first with the Board of Health. Charlotte Quist.
Here.
Mike Blacken. Here. Carlo Meininger. Thank you for coming. Megan Evans.
Here.
Russ Swan. Russ Swan's usually on the conference call, so I'll get him in a minute. Tom Rice. Here. Nicole Hazelbaker.
Here.
Okay. Okay, I'll say Russ Swan again. Are you on the conference call? Okay. Under.
I ask a question that has to do with
Go
the
ahead.
meeting, how it's ran right now.
Go ahead.
I've been asked by a public person that this is a public meeting by the Constitution and has to be open to the public. You cannot restrict number. If you do, you gotta find a bigger location. Also, you cannot do it over Skype, or this is not Skype, this is telephone. The public has to be able to see each person that's on the board and how they look, how they vote. It's gotta be done in person on that. Just stating that's
thanks.
how
We got empty spots, I think, 2 chairs up there on our.
And we have a quorum in the room.
We have a quorum, so thanks for the comment. Okay, under technical advisor, Sue Hanson,
Here.
Tom Wagonette,
Here.
Laney Jones. Laney Jones, a lot of times she's on the conference call. Carol Kennedy. Carol Kennedy's on there, we'll go back. Aaron Montgomery. Ben Abbey. Here. And Marie Holt.
Here.
Okay. And then on the conference call that are on there, go ahead and turn on and then state your name, please, if you want to be on the, in the record.
Don Gabbard, Chief of Police.
Okay,
Mark
next.
Simpkins, Pioneer Federal.
Next. Is there any other?
Phyllis Saxon, Metro Hotel.
Phyllis Saxton, McMillan Hotel.
Phyllis Saxon, S-A-X-O-N.
Next,
Danny Deanne, community member.
Damian,
Damian,
Dion, G-U-I-L-L-E-N.
anybody else?
Julia Incentive and Karen March, Public Health.
Okay, next, next. Is there anyone else? Okay.
Jim Dolan, city.
Okay, next then. Anyone else? Okay, with that said, I'll ask Russ Swant again. Are you on the conference call? Does anybody know Russ' phone number? Where he's at? In case he just overlooked being here.
You need Rush Schwant's phone number?
Yeah, do you have it?
I do. (406-498-1753).
Say the last four again.
1753.
Thank you. I'll call it.
Okay, thanks, Ben.
You might not be answering because I recognize my number.
Or maybe he doesn't.
I got his message machine. 498-175.
I can text him.
Ronnie's texting us or something, go to see. Texting.
He's not answering you either, Tom.
That's all right.
Hello? Russ, hi, this is Jeff, Fix the Board of Health meeting. All right, perfect, I'll let the board know, thank you. He's just ready to call in, he was just in the clerk's office. He's calling in right now, so.
He said he's calling in right now, so you can mark for, well, wait till you hear his voice. Are you on, Russ?
Hello, this is Mark.
You'll have to state your name again, whoever that was. Okay, Russ Swan. We'll assume he's going to call in. Okay, with that said,
Mr. Rice, this is Russ, my apologies.
okay, thanks. We got Russ Swan. And Mark over there. We got the entire board here, I think. So that's fine. Okay. I assume we have, I thought I said we have somebody here when I call that's from the rodeo committee as such. It's Jason. Oh, okay, Jason.
What would you can tell us with the mayor on the
Can you mute your phone? Can you mute your phone, whoever's on there? Okay, Jason, the fair board. I mean, two from the fair board, okay. Got that.
Chief Hanson's on here too.
Oh, H on.
Good morning.
This is Mayor Dave Olson, Lima.
Yeah. I thought I did the voice.
I did too, but I wasn't sure.
Okay.
Kim Arnett, Buckfield.
Go ahead. She's a technical. Okay, who just spoke up? All right. Okay, that Kim's on the technical advisor. Okay, we've got, well, the purpose, there's numerous ones in the room are here for the Labor Day events. And we'll start with that, I suppose. And how about, we start off with, F comes before R. How about the fair? Would representatives of the fair come up to the mic, if you would? Okay. Last week, as all of you recall, we met with the fair and the rodeo committee and this and that. And they went over things with the Board of Health. And then we've each on the board received a new transcript of how you met some of the requirements that were asked of you last week. Am I correct in saying that?
Yeah, the plan we presented last week, yep. Yep, that's the plan, and then if anything is approved, and work anything else. Is that what you're asking, Tom?
Yeah. Okay. With that said, is there any comments regarding what you read or anything from the Board of Health? Anybody on the Board of Health have comments in regards to recent sheets from the fair board?
I think the only comment I have is, given current restrictions on masks, I think the recommendations both for the fair and for the rodeo was masks are highly recommended. Perhaps we need to change that language to reflect highly recommended or in compliance with the governor's current recommendations. And I'd phrase it that way because we do not know what the current governor's recommendations are going to be by Labor Day. So I guess I'd like to make that change.
That sounds great, Charlotte.
Yeah.
That we can do that, we can put, broad language, referencing the current government compliance.
Great. Mute your phone. Those on the conference call, please mute your phones. Okay, Sharp, is that, and the fair board confirms that change? Okay.
Absolutely.
Any other comments from the health board?
Did you guys decide on the date change at all yet?
It sounds like we met with the schools last night at a meeting and all the district superintendents, and they support whatever we decide. They said that, whatever they feel that our plan is good and moving forward, they would support whatever we decide to do. And so the fair board is going to meet on Tuesday after we find out the decision today, and they'll make a decision on Tuesday.
Okay, with that said, is it, no other comments from the fair board? I guess just I'll close this, we'll call for a vote from the fair board. On the fair, from the Board of Health board. And what I'll do is so everybody stays straight, I'll go with a roll call vote. And I'll just go down to the fair board members and I'll list myself as the guinea pig first. Then I'll vote Tom Rice. Pardon me?
You're meeting in the city county health board, right?
Right.
You missed when you said fair board, Tom.
Oh, I meant the fair board, we'll vote on the fair. Okay, so neither, we voted in regards to the city county health. Okay, myself as chair, I'll vote first and I vote for the fair. And Vice Chair, Charlotte Quick,
I vote for the fair.
Mike Lacken, 4. Carl Weininger, 4. Nicole Hazelbaker,
4.
and Megan Evans, 4. So that's 1, 2, 3. Russ Swan.
4.
There's a 4 there. Okay, so I have a unanimous votes by my calculation for the fair. Congratulations on working with us and we working with you, and we'll continue to work together.
Perfect, thank you.
Thank you.
Thank you, you guys.
You better be, you can go back and.
Go for it.
Okay, next I call the representatives of the rodeo committee forward. And again, we received an email in regards to how the changes that we visited with last week, with reference to the sections, the color-coded sections, you divide up in blues here, yellows here, red here, whatever, and those type of things, but I'd ask for, what's that?
Those car doors.
Somebody's got their phone on opening their car door. Anyway, we just like the fair, the rodeo committee was here, we went through their plan, the fair, Board of Health asked questions back and forth, they worked together to the best of my knowledge. And is there any other questions from the fair board again? Fair board. From the Board of Health board, to the Board of Health board to the rodeo committee in regards to this plan? Go ahead, Mike.
Is this just rodeo or is this also concert?
No, this is rodeo.
Okay, rodeo. Because last time you represented.
We'll represent both today also.
But they're separate.
They're a separate committee because there's no concert committee here. This is just the rodeo. Okay, is there any other questions from the Board of Health to the rodeo committee today?
I'd like to say we agree with the recommendation on the masks. If the requirement is still that they have masks, then we would require masks.
We may have to provide some.
Yeah. And we're prepared to do
See
that.
them real nice ones?
And we can get some on order from Beaverhead Home Center. Talk with them. They have the supplies from stock.
Did Nicole, did you have a question on the conference call?
Yeah, I have a couple of questions.
Okay.
I didn't get the updated information, so maybe some of this was answered in the updated information, but I do have some questions. I know that in the last information we got last Friday, it was stated that the rodeo will follow the PRCA guidelines for COVID. And I noticed in their guidelines, they are saying that you're to rope off an area for no more than 10 people to sit. And I think it was listed on the plan for 50.
And we updated that with the help from Ben Abbey. We changed it from 10 to 50. Some places at the fairgrounds will only allow 10 people per section. But again, there's some that will allow 50, which is up to the governor's recommendation. So it's 10 to 50 depending on the area.
Did you catch that? Did you catch that, Nicole?
So the PRCA says 10 people.
But that varies with sections of seats. You know, some places are smaller, so they narrow it to 10 people, they'll narrow it to 10. Other places are bigger and it will handle the 50. We discussed all that in the last board meeting. Ben Abbey came up with that idea.
Like for instance, the grandstands will only allow for 10 to 12 per section. But I mean, we'll get it dialed down. But Ben took a lot of time and went through the grandstand seating it will only safely allow 10 people per section, so.
Yeah, but Dr. Abbey worked with them very closely on that, which I thank him for.
Yes.
Okay, so
Any other questions, Nicole?
yes. Also in the PRCA document, it says that the food mostly needs to be prepackaged and that it needs to be sold in the stand. Are you planning to do that or?
Our food is already prepackaged, I guess, is, we're not handing it out, it's wrapped and
Okay, there's somebody in back of Nicole that has their phone on. So Nicole,
Yeah, I'm getting a lot of feedback, so I'm not.
it's on
hearing
it's on the people on the phone that haven't, or on the conference call that haven't muted their phone, which is a problem. Okay, Nicole, go ahead with the next question.
Okay, I didn't hear what was said on the food. Is it prepackaged or you?
Yeah, it's prepared and then packaged, you know, and it's given to the people in a package, yes.
It currently is set
Okay.
that way.
Okay.
yeah.
And are you doing the selling through the stand or are you going to have a concession stand?
It's just the same 3 or 4 concession stands that we've used historically.
It's the 4 historic concession stands that Ben Abbey worked out that these sections will probably go to that concession stand because it's, but they have the option of 4 concession stands to go to to help with the spatial separation there.
And then we'll have it marked out in front of each stand, the proper spacing.
The proper spacing, is that what you said?
Yes.
Correct.
Okay, okay. And then, I know that I don't recall now if this was in your plan, but you talked about having ushers, is that correct? To seat people and
We do have
seat
ushers
people
currently.
in their group?
We do use ushers currently. It's a volunteer group. Typically Kiwanis.
Did you catch that, Nicole?
I did not.
They do have ushers right now. The Kiwanis have volunteered to be the ushers.
Okay. I know in the giving people power, so I'm just concerned about having enough people to help the JCs through this. I know that that's been a concern at past rodeos through the years.
We've also got a hired security team there as well that will be assisting.
Okay.
And with our,
So what's the conversation with your stock contractor? What's their plan? Have you gone over their plan for COVID?
He developed a plan for his drive-in rodeos that I forwarded on to the county health board back in May.
Yeah.
He would fall under volunteers, so he will also be health screened at the gate.
I know the truck contractor is hosting rodeos at their own ranch, and they're doing it where people drive up so that they're not getting out of their vehicles. That's why I was wondering if they had any say of how they want the rodeo ran. I know Sankey has some pretty strict guidelines without COVID.
He's also been running other rodeos, nothing in Montana, but they have Filer, Idaho Labor Day weekend that his dad goes to, that isn't canceled on.
Yeah. Anything else, Nicole?
No. Thank you.
Okay, thank you. Now, is there any other questions that the Board of Health Board would like to address the rodeo committee? I did good that time. I'm just talking to right here. Okay, with that said, we'll have a roll call vote on the rodeo. And I'll go down through and I'll put myself first and Charlotte, right there. Tom Rice votes yes for the rodeo. Charlotte Quist.
I'm going to vote yes, but I'm going to make a comment. I think we're at the point in this COVID outbreak that individuals have to take some responsibility for choosing what events they're willing to attend and what risks they're willing to endure. Personally, I think any group gathering like this, even with masks, there is an inherent level of risk. But I respect the decision of those people if they want to go without masks, if they want to be in a gathering. Again, I think there's a certain level of personal responsibility, so I'm going to vote for it.
Okay. Mike Placka.
Yes.
Carla Weininger.
Yes.
Okay, Megan Evans.
Against.
Russ Swan.
Yes.
And Nicole Hazelbaker.
So this is a really hard decision, because my family has a long heritage of Montana Civic Weekend. In fact, my father-in-law is the one that came up with Montana Civic Weekend. So there's a lot of heartstrings with this, and I've watched through the years this be a great thing for the community and an opportunity for the JCs to put on something for our community. But I'm also looking at our medical providers that requested, because of their expertise in this field of COVID, that they had requested that we not allow this to take place. So I've gone back and forth and done some research on the rodeos that have happened and what the PRCA is stating and what the stock contractor has done in the past and what Sankey's are doing now. And so because of all of what I've seen and heard and in support of our medical providers, I am voting against having the rodeo.
Okay, thank you, Nicole. Okay, by my count, it's passed 5-2. Okay.
Thank you, guys.
All right, thank you.
We'll do what we can to make it Montana's safest weekend.
That's a nice quote. With that said, I've got you up here. Would you speak for the concert committee? And recall, I've got a back here for that. If anybody would like the current, what I copied this morning, anybody would look at it. Okay, is there any comments from the board to the JC Concert Committee?
I have something.
Go ahead, Nicole.
I think it was requested or questioned last week if they are willing to not have alcohol.
At the concert?
Yeah, was it at the concert or the rodeo or was it both? And I didn't know if any decision was made on that.
Yeah, we eliminated the hard alcohol sales. We'll still sell beer, but no hard alcohol at either event.
And then limit like we have been last year. We started, so you can't take 20 beers to your season.
Did you catch that, Nicole?
I did, thank you.
Okay. Other comments, Nicole?
No, thank you.
Okay. Is there any other comments from the Board of Health to the concert committee?
Am I going to add the same statement that Charlie brought up, follow whatever the state guideline is?
You wish to do that?
Yeah.
Yeah.
Yes.
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 So what Charlotte brought up before, can you state that again for the record, please? Or can you read that back, possibly?
I recommended that the language about masks be changed to, I think it said how they recommended to reflect whatever the governor's current mandate is at the time of the event.
Okay. With that said, this is the concert committee, and I put myself up front again. I tossed this around, and the number of people in the dark and the issues that all go with it. And I support the fair wholeheartedly and support the rodeo wholeheartedly, but I have to vote no on the concert. Okay. Charlotte?
I agree with Tom, I vote against the concert.
Mike Black?
Yes.
Carl?
Yes.
Megan?
Against.
Russ? Swan?
Against.
And Nicole Hazelbaker?
Again,
Okay. With that said, the concert is not approved, and the vote was 5 noes, 2 yeses. Correct? Yes.
They just asked, since that was not approved, that we receive a letter so that we can send to the entertainers, and then we are not.
We'll get that to you right away. I totally understand your position, and with our approval, probably you'll be reimbursed and stuff like that too. So, we'll get that to you.
Okay.
Thank you.
Thank you.
Probably be public knowledge today.
Yeah.
It'll probably be public knowledge today, so the sooner the better for us.
Yeah. So we can look.
Well, we can be, it wasn't approved 5-2
Yeah.
Yeah.
by the Beaverhead City County Board of Health, so
Yeah, just the same letter we got for the demo review would be great.
that'd be fine.
Yep. Thank you.
Thank you.
Thank you.
Thank you.
Thanks.
One more thing I'd just like to say too is I think it'd be good as a group too, even though this did pass for the rodeo, to keep tabs on how things are going. And if things get a lot worse, I would still reserve the ability to cancel things if things become more concerning.
And the ultimate decision is on us. I mean, today we got approval, but I mean, a month ago, things looked a lot more,
Yeah.
I mean, it's just, like I said, it's ultimately our decision, so.
I wholeheartedly agree with what Dr. Evans said. I have a lot of trepidation about this, and again, as I mentioned, I'd love to see it go forward. I always go, but I'm not going this year. You know, even if you host it, there's no way I would. And I'm with Dr. Evans. If things keep heading south, then I think you all should think hard about it.
Well, thanks again.
No,
And
thank you.
I'd buy a couple of your masks.
3D and Dylan.
3D and Dylan, okay.
Yeah.
Thanks a lot,
Thank
both
you.
the fair committee and the rodeo committee. Thanks for all your effort. Make it a safe weekend. Okay, I mentioned the parade, and they said that they would, basically see if the parade, if we chose to do it, we could they could get the plan to the Board of Health within 2 weeks or 3 weeks ahead of the fair and the rodeo. So the fair is not a topic as such, or excuse me, the parade is not a topic. As far as rodeo, Labor Day events with the JC. Now, is there anything else I'm overlooking as far as Labor Day at the fairgrounds? I got that covered. Okay. Then I had-
Tom?
Yeah.
Is the parade included in this
No.
vote again, so you're gonna have a parade then?
No, we don't, the parade committee hasn't brought something to us, and they said they won't till
They said they're not going
a
to.
couple weeks before the rodeo.
Okay, just wondering if they're gonna have it or not.
Well, they don't know and we don't know.
So when do you expect to know?
We made a decision on parade.
Talk to the JC.
We'll take the Board of Health's recommendation on parade.
Oh, we're not gonna have it then?
We don't know.
We don't know yet, okay.
We'll see how it comes on.
Mike,
What's the recommendation of the board of health?
for the break, we don't have them.
Yeah, we haven't submitted a plan or
We haven't
anything.
seen a plan or anything.
So you're gonna wait?
Again, we wanted to see how they went. If everything got canceled, we weren't going to do the parade. But since the rodeo passed, we can look into the parade.
Okay, thank you.
And then they'll come forward with a plan for that, which is proper procedure.
I hope you guys decide to do it.
I want to drive my other car.
Thank you.
Okay, I guess we'll shift I'll go right back up to the top, testing update. Go ahead, Sue.
I would like to make a comment before we get started. There is a governor mandate that people in a public gathering must wear masks, and I see two people here that are not wearing masks, the mayor as well as Mr. Franken. I'm wondering why.
He was approached by law enforcement, he's an asthmatic.
Asthmatic, I can't,
Against
triple
it,
face, it's in the governor's.
you know, and,
And actually, by the governor, you can't even ask him. He
Well,
can
we-
say, I have
I
a
mean-
medical condition, and you just violated HIPAA.
well, but we know each other.
And you don't have your mask on,
Oh, come on, Mike,
I'm
don't
speaking, I don't have
say
my
it.
mask on.
Don't say
you're
it.
not speaking.
What am I doing right now?
You were sitting the whole time and you did not
You don't
have your mask
value.
on. I'm just calling out, if we're going to do this, then we need to do it correctly. That's all.
Okay, then when you do this, this is about the worst order I've ever read. He's making it a crime to do this. And all the other crimes that I know, it's if I break the law, not if somebody else does it. So now, if somebody walks into a store and they're not wearing a mask, the person walking into the store doesn't get arrested. The person that owns the store, and they might not even be there, gets arrested. That's terrible law being put out, in my opinion. That you're going to enforce a law by trying to get somebody that owns it. You're just trying to shut businesses down. It's one thing to put a mandate out if you're going to tell the person that's not wearing a mask that you're breaking the rules, but not the owners.
You have a comment there?
Well, I do have a comment. Jed Finch, County Attorney, we've had several conference calls with the governor and staff about this. The exact issues that the mayor brings up were significant concerns of the county attorneys. How to enforce this, who to enforce this, who to enforce this against. As you might have seen, there was a letter from the sheriffs and peace officers that the county attorneys endorsed, which should be educational based. But to the point that the mayor brings up, the onus and duty from the governor's order is in fact on the business owner or the sponsor of the event or activity. So in this case, it's on the Board of Health to enforce the mask rule in its presence. And if a person is there that refuses to comply with the mask rule, they should ask them to leave. And then where it is on the onus of the person, as the mayor brought up, which I believe and agree with him that it should be, if they refuse to leave, that is then trespassing in a private business. And you could be ticketed for trespass, the individual would. That's the theory behind the governor's mandate, as I understand what it was explained. And this is not offered with agreement or passion or opposition. I'm only trying to state what the governor's ordinance is. And so I understand it to mean that if someone refuses in a situation to follow the mandate, that person, if they refuse to leave when asked, would then be guilty of the crime of trespass. So, for what it's worth, that's my level.
Jed, does that mean that if there are people in the room that don't have masks on, since this is the Board of Health's party, if you will?
In theory, yes, the Board of Health should be enforcing the wearing of masks in a gathering like this, inside where there's a large gathering of people. It doesn't matter whether there's 50 or not. If you're inside in a place, it's masks are mandatory, regardless of the number or the ability to social distance. Outside is a different question.
unless there's an exception. You can be one.
Yes, if you're under 5, you don't have to wear a mask.
8 or 10 exceptions.
Yeah, there are several exceptions, concur, agreed.
And one of them's.
This is John Iverson. May I jump in here?
You bet, Don.
Okay, so this puts law enforcement, and particularly me, into a very difficult position. I stated at the council meeting the other day after the governor's mandate did come out, that I'm just wholeheartedly asking people to comply, not because I totally understand the law. I'm legit as far as the way I've been instructed about it, and I also believe that what Mr. Platten said is accurate as well. So the three of us, I think all of us are in the same area of thinking in that aspect. However, at the end of it, it puts the enforcement upon law enforcement to charge trespassing if the things are handled correctly. So I would strongly encourage and ask, please do not put my officers in that position, nor me. We're put in very uncharted territory here, and everybody has their opinion, everybody has their beliefs, and on top of that, we have to understand the law and listen to the Constitution as well. Sometimes interpretations, mess with each other, depending on who's doing the interpretation. So I'm just going to ask on behalf of me and my officers that we would follow that mandate, whether you believe it or not. They could work, they could not. It depends on how you look at it. I would just ask to do it for us and not put us in a very delicate position, because I think all of us, including the Board of Health, everybody involved here is doing their best. We're all doing our best in what we feel is right for the safety of the public. And and I'm going to be frank here, and I hate to use the language, but this is a really shitty position for everyone. And I thank you all for doing what you're doing, because nobody signed up for this COVID thing. But I would just ask that we try to follow the mandate as leaders of our community. Thank you.
And I am believing I am following the mandate, under the exception of during talks, speaking.
You should put on your mask when you don't.
When you're not talking, it has to be on.
What does the governor's mandate say? First off, it says you're supposed to take a liberal interpretation.
Just hold, Julie, wait just a minute. He's not done.
Okay.
It's supposed to be a liberal interpretation. You're really not even supposed to ask the person, So now other people, everybody's going to read it differently. It's the way it's sounding like.
That's true, that's what happened. So for my interpretations, if you're asking me, Mayor Clacken, would say, for example, Commissioner Rice, who's administering the meeting, probably not going to wear a mask. You watched the governor in his press conference, he didn't wear a mask when he gave his presentation, but he wore it up until the time he began talking. I'm not taking mine off right now, because I think that part of the problem is you're not supposed to touch the mask all the time either. Correct. I've been wearing a mask in this courtroom since June 1st, as mandated by the judge, and I leave it on while I'm talking, but it is really hard to hear some witnesses. And I had to work on my enunciation with this mask to satisfy the court reporter. But my answer back here is when it moves on, when someone else is doing a presentation, you should probably put your mask on. And you should put your mask on over your nose, according to the governor's mandate. So that's the way I read it.
Okay.
But I'm not the mask police, I'm just the county attorney.
If I can say something?
With that said, this is Julie Green.
Yes. And
Just, can you mute your phone on that conference call? Go ahead.
I do have some concerns, because over the course of this whole thing, we've had wear a mask, don't wear a mask, wear a mask, don't wear a mask. I've talked to medical people within our community. I've heard things on the internet. I've seen things on TV. Today, I've seen people touching their masks. I know what the proper protocol is. My work. I do have health issues as well, and I don't really feel that I should have to explain that to people and to point that out to people when they're not wearing a mask. I feel it's wrong. I have seen numerous people at the funeral home that do not know how to wear the mask. And it's my understanding, if you do not know how to wear the mask, it's worse for your health because you may end up infecting yourself with something that you didn't have been infected with in the first place. So I was wearing a mask when we first started this whole thing. I was having trouble, and I was having health issues because of it. I will wear a mask when I'm required to, but my health may suffer from that. And I don't like to be pointed out if I were to walk into a grocery store. I don't think it should be somebody's job to point it out.
I gotta cut you off. Thanks for your opinion. Now, back to your testing update. Stay on that topic.
So currently, right now, we have 5 active cases and 2 presumptive coming up. And what that means is those 2 tests need to be confirmed through the state lab. And I'm pretty sure that they will be. So we'll have 7, but we do have a couple of them that will be coming out of isolation. So it still puts us at the 4 or more active cases. So the mask mandate will continue.
Okay. Yeah.
First off, and I think you kind of answered it, but just for the record for everybody, suddenly it becomes a mark on us when they come in and say they could be infected. And it comes either to the public health or to the hospital, is that correct? When does a decision be made that you're positive?
That we have a case.
Yeah, I understand, when does the testing occur? If somebody comes in and says, I think I'm infected, I know quite a few people that came in and they've been turned away. They don't get a test. They said, just go home, and if you seem like you're getting worse, then maybe come back and we'll give you a test. Even though we did 100 tests on kind of just random, just curious why. And then when it's done, or how is it determination it's done? Do we do more tests? Do they just go through the 14-day quarantine and then they drop off the list? Because now before it wasn't that important on when you have to be concerned or how many, I mean, people are concerned, but now they put it in the law that you're breaking the law if you have over 4 or 4 over, excuse me, if that's what I remember. Now that I don't wear a mask and the county has over or 4 over, now you're breaking the law in certain specifics. When does that go off? Or when's the determination that it goes off? I know if you get less than 4, I think, it goes off. But does it just fall off after 14 days quarantine? Or a couple tests negative? Or what's the determination? Those are more questions, not.
Yeah, so let me try to answer you, because there's a lot of components to that. So it's not to my knowledge that anybody's been turned away that I know of. We were trying to test everybody that wants a test. Testing has been a little bit more delayed than usual at the state, and that's why they're canceling some of those asymptomatic screenings. A test is positive on the day that we get the result. So then that's when they would be counted, because we can't count them before. We have machines at the hospital that still have to be validated, which means they're positive at the hospital. So the state has to confirm that that sample is positive, and they want 5 of those before we can let our machines go on their results alone. So we still have several of those to get through. So those are presumptive positive until the state confirms, and then they will be a positive and they will be counted. Then the other rules, as far as how does somebody get through and leave a case, well, I guess I should say too, not everybody that we've tested that is positive is counted in our county. So we've had a lot of swabs that we have done locally that we get called about, but they actually live in a different state or a different county. So they don't count within our county even though their test was here. And vice versa too. So there are some people that might be positive and that this is their residence, but they were tested somewhere else. So For someone to leave the numbers of active cases then, they have to essentially get through 10 days from either their onset of symptoms. They have to have at least 72 hours without a fever and an improvement in their symptoms. So if they make it that 10 days, then we can clear them. So I believe we have a couple coming up soon that we can clear. It's a little bit different for people who are close contacts because they are in quarantine for 2 weeks. So it's a little counterintuitive, but close contacts may be in quarantine longer than someone who's positive is in isolation. So of course we aren't counting people who are contacts in our numbers, right?
You're gonna have to mute your phone again. Either that or tell us who you are.
So it's communication between us and the state on when they get removed from.
That moves it on, but not, they just automatically drop off after, and you guys determine that when they come to public health or the hospital, the temperatures have went down and the symptoms have decreased from what the record was at the beginning.
Right.
Now, I do know, you know, one of the things is there's several people, not just one, that some of the cases that came around, it's been determined positive, you know, that they could have maybe been caught or helped. You gotta somehow get it out. And we're relying upon the person that's infected to remember everybody they've been within 15 minutes of it, right? Or 50 minutes, and what happens, and the whole system falls apart if they don't remember. And I think that's happened. And I think there's several people that came in saying, I've been in a car with this person for over 15 minutes, and you won't test them. Why?
I don't think we've turned anybody away that was concerned.
That's not what I've been told by these people individually. They've been turned down of getting a test, and that's what I'm just asking.
Yeah. No, I agree.
There's more than one person who's told me that, and I'm wondering, why are we turning down people that are walking in saying they might have it versus ones that are just driving, getting in line, and we're giving 100 tests to those people than not to ones that might actually be infected.
Yeah, and that's happened, right? And it's going to happen because when we've interviewed people, they don't remember everything they did in the last 2 days, you know? So, but we can't tell what people's identity of a positive HIPAA, with, you know, we can absolutely not do that. As medical professionals, as public health department, we can't.
Right.
If people though want to be open and say it to their, you know, to people, then I think that's fine. That's their choice, you know, but it's not a perfect system because not everybody's going to remember everywhere they were. But I've had some people call and say, I'm worried, I want to test, and we have tested them. So.
Now, and maybe not the hospital though. You guys might, but it sounds like these people went to the hospital. Just saying. I'm just telling you what I've been told by these people.
Well,
And I don't believe them went, you know, when they called, they told them to either go to public health or the hospital. And I believe they decided to go to the hospital.
And I think that's fine. I think if you hear about that, have them call public health and we can work out something, you know, what's needed. Because maybe they are in contact.
So I'm Sandra McIntyre, one of the providers here at Spirit Hospital and the clinic. I will say that early on, so months ago, when we were still trying to sort out what testing would look like, and we did not have testing available in any meaningful way, at that point, there were times where we did just ask people to go home and quarantine, and we did not have testing. We didn't test them primarily because we didn't have the means to do it effectively. I would say as of certainly the past 2 to 4 weeks at least, to my knowledge, nobody is being turned away from a test. They're not necessarily getting the test they asked for various reasons, meaning we're not doing immediate testing at the hospital for most people, but everybody is being offered as symptomatic or asymptomatic into the state. So for the past 2 to 4 weeks, if anybody has been turned away, that would have been inadvertent. And if you know of someone like that or anybody hears about that, send them right back to us. Thank you.
It was these were, and then it was several of them were the contact that went, the kid that went to Missoula. And they went in saying, I had, and even though they were not flagged, because the kid probably forgot.
So again, I can't comment to the specifics, but I would say if you know someone like that, please ask them to call their provider, and we certainly are sending asymptomatics
test to the state, across the board.
And maybe I can also ask another question since everybody's up. I'm still having my mask on, still talking. Okay. What's the determination of when they go into the hospital? Or maybe another question is, how many COVID cases have been in our hospital since it started?
I don't know that I know that number specifically.
How many people have been turned away when they said they wanted to be in the hospital? How many, by saying, you're not bad enough, we're going to send you home and just go home, and if you seem to get worse, come back. Anybody know that number?
I don't think I'm going to comment on how that type of care is provided, except to say that absolutely people are screened, managed, and we do the best treatment plan for people, whether it's an admission to the hospital or a home with active surveillance. So
We've seen an increase in hospitalizations. So we have put people in the hospital due to COVID lately.
In the state?
No, in Beaverhead County. Because the hospital said, we don't want any of this stuff because we're worried that it's going to go crazy.
I will say that any person who met the criteria for hospitalization absolutely were hospitalized. And people for whom treatment was better served in another circumstance, that is how we treated it. So those medical, I feel 100% confident in the medical decision making that is occurring in the emergency department and from the hospital admission standpoint. And again, I would say
Why can't you tell us the number?
I don't know it.
Oh, okay.
And I don't know that.
And that's a simple answer, don't know.
Yes.
Well, this is
So-
a peer debate.
right.
No, this is not a
So
debate,
what I-
this is actually
what
asking
I-
questions.
what I-
Don't start trying to shut me
What
down.
I would say today is if people are hearing from people in the community that they have concern about that, to direct them to the hospital, we are happy to have those conversations.
Okay?
Thank you.
Thanks, Sandra. Thanks, Megan. Thanks, Mike. Okay. Any other on the testing update is complete? Is that discussion?
Am I allowed to ask a question?
Yeah, you have to come forward though. State your name. Don't touch, the mic's right there, but don't touch it.
Just breathe on it.
Stephanie Osborne. I was just wondering about, kind of sort of touching on what the mayor said about the active cases. As soon as that threshold goes below 4, what do we send them out saying, okay, masks are not mandated, we highly recommend them. 2 days later, we get 3 more cases. Oh, masks are mandated. How are we gonna, since we're so close to that 4, how do we balance that? How do we balance that in our community with, what's going on? That was kind of a.
Sue.
Thank you for bringing that up, because we've had a lot of discussion on that. It's
I'm
like,
sure.
We could go back, like you said, 53 or whatever, and that night we'll get one, and we're back. We can't keep going back and forth. That's craziness. Nobody's going to be able to keep up with it. Businesses are not going to be able to keep up with it. I have my own idea what I feel would be appropriate, but I guess I can open that up to the Board of Health.
Basically, that's the governor.
Well, we can maybe start your,
You can make a decision.
or Board of Health.
I believe the governor is going to have a list of counties that are currently under that requirement. I haven't looked at it yet, but I mean, that would require me looking at it every day. But I mean, for me, the simple answer is I'm just going to wear a mask all the time, and I have been.
Right, and that's your decision, and there's so many other people out there, whatever is in this county, around 9,400 people that live in Beaverhead County, that not everybody wants to have to put a mask on their face because of 4 active cases out of 9,400 people who actually might not even be in this county, but are from this county, so it counts towards our county. So I just wanted to know what, I'm going to have to do when it goes below 4. If I can walk freely in the grocery store and feel comfortable and not be suffocated with my face under this mask.
Jeff.
On that point, you're right, it's the daily count, and if it changed one below, then the business would not be required to have the mask or the mask requirement
any business, if you've seen Walmart has made a requirement nationwide for masks, with some, probably some differences there, but mostly nationwide. Other businesses have required that. The local health board in some counties has made a decision to have a mask mandate absent, separate, distinct from the governor's. That could happen as well. But to your direct question in regard to the ordinance or the mandate from the governor, ordinance is the wrong word, the mandate from the governor, it depends on how many there are in that county. So if you want to know, you have to check the number.
Okay.
And if it's below 4, then the mandate would not apply.
Okay.
And if it's above 4, it applies.
Okay.
That's what the governor's mandate says.
Okay. And that's updated, obviously, would it be updated daily or as cases come or are dismissed as active once they're discovered?
They maintain a website with a map of every county, and it shows the number for each county active at that time according to the state health department.
And it's updated daily at 10 o'clock.
Okay, perfect. Thank you very much, I appreciate it.
Great question.
Okay. Is there any other questions regarding testing or that? Seeing none, we'll go to upcoming events. Is there anybody out there that has a question about upcoming events or from the Board of Health? Yes.
Yeah, the mechanical bull riding is going to take place. It's going to be outside of the old shop building, that's what I call it, I guess. And they are going to they're going to have seating for 50 people. They've got some pretty good guidelines out.
So this is a plan?
No, this is just as information.
So, Sue, if I could interrupt you, I'd like to know if your department okayed all this, because this has not been brought to the Board of Health.
No, it's not. When Stacy Roundy talked to me, I didn't know there was a bunch of those other things on there. I was just aware of the city inside the little booths where the streets cut off, so I don't know if you...
So I think it's interesting, I guess because he's on the conference call and he's also on the Board of Health, I gotta ask Russ Schwamp. I gather there's a committee that put the Dillon History events or Dillon History Days together, and I'm just wondering if all of these events have been properly screened for the protocols they're going to use to avoid any undue risks to people attending it. I'd put it to the committee, but since you're on, Russ, I'd like to ask you.
Sure, good question. Thank you. I apologize, I know some, I haven't been a faithful participant in that committee, but however, each event has been spaced out throughout the town to comply with COVID. There is wash stations and an entrance at each location with a volunteer handing out masks. I do agree with you all that this was not truly a proposal that was brought forward. I think it was one of those things that slipped in. People knew about it, but we did not hold them to the same standards as we held at JC. And I share other committees, so I do apologize.
And Stacy and I have talked a couple of times on it. I mean, I don't know about those other events that are happening.
Yeah, there's quite a list. I'm involved in the Tendoi Gallery, and we're down as having an art walk, and just as a note, we're going to cancel our participation in that. Do I think that there's going to be more than 50 people at any plus, any of the artist events? It was going to be done as a sidewalk event. I don't think so, but that being said, a number of our artists are in older age groups or otherwise have health risks, and I don't think it's a good idea. And so the board of the Tendoi Gallery has decided to cancel that. Just has the appearance of impropriety.
No, very respectful.
Any other comments on the Dillon History Days from Sue or any other Board of Health members?
Are you proposing that they submit a plan to the Board of Health?
It is, well, what is today? Today's the,
17th is next week.
I think it would be,
Next Friday, Saturday.
I think it would be good if any of those events on that list have the potential of gathering more than 50 people. I think that should at least be run by your office, Sue, and if it bumps up to where you have concerns, then it needs to be brought up in front of the Board of Health.
Now, if I understand what happened.
May I speak at this point?
Yes, go ahead.
Okay, this is Don Mackerson. I just want to put in there too that with the history days, I talked to some local businesses, kind of gone through some of the people that run bars, restaurants, that kind of thing, not all of them. And so they have a decent plan in order. However, I mean, it is going to be difficult. And the bull riding thing, I was somewhat aware of. But as far as enforcement goes, it's going to be extremely difficult for us. And that I don't have a decision or a vote in whether they go forward or not. So I'll keep that to myself. But enforcement is going to be difficult. I do, however, believe with the history days, it will be a lot smaller than what's going to possibly happen over the Labor Day weekend. And so we're going to kind of gauge that. If it does, obviously it's slated for now. We're going to kind of watch that, and maybe it'll give us an idea how to game plan for Labor Day as well. But Shelley McDonald at the Mac Labcast has kind of put together some schematics on how they run things and whatnot for the history days.
Could you, with that said, Sue, could you get a hold of Shelley McDonald and somebody from your staff to sit down with her? Because she knows that, I mean, you didn't work with the JCs that way. I was there.
Well,
And but
What I understand is, I told, they're setting this up, I told Stacy to talk to Sue. And she did, and I remember that you said that you're interpreting it, that it's businesses, and it's just like the businesses have their store out front. Because that's all they're doing, they're not getting in all together, it's every store owner or owners are going to handle it out front. And that was approved, that's saying that. Now, I don't have any clue on the bull riding, that was something new that I didn't know he was still going to happen.
Yeah,
But
you're right, and that's exactly.
and so now we're sitting here going to shut something down that's less than a week away, or about a week
We
away.
didn't say anything about shutting anything down. I just advised
Well,
that
first,
we
we
should
have to-
look.
you're
Excuse
saying-
me, Mayor. I just advised that I think we should look to make sure that businesses and so forth have an idea of a plan for mitigation of any risk if they do go forward.
And that's what I understand was running off of the plans that they put out when it came through the first round. We're running off of all the businesses' plans.
Good.
I believe like all this other stuff is are their own organization that's putting this on. So I think the city's doing the Dillon History Days, but all these other organizations, I think specifically are doing their own thing. And that's what I didn't know. I didn't know anything about the music in the park or this car smash or car show, or I knew about the mechanical bull riding. So I don't know. We talked about the city part, like you said, but none of the other stuff. So I guess if they can get with me, these people who are sponsoring these other events.
As soon as they get back, I'll have Stacy get hold of all of them to get all the suit.
Okay?
Excuse me, it's Russ.
Yeah, Russ.
So we would glad to have you Monday at noon at the city. That's when this group meets. So meet Monday and Wednesday at noon of next week.
Okay.
Okay, so you have to- Thanks, Russ. Okay, any other upcoming events? Seeing none, we've got review of phase 2 guidelines. We put that on here because there was some confusion. Is there anything that needs to be reviewed or in that? That was a discussion right at the closing of the meeting last time. So, seeing none. Now we're going to old business. You, the board, received a copy of the minutes for July 10th.
Move to approve.
I got a first and a second to approve the minutes. All in favor, say aye. Aye.
Aye.
Both same sign. Hearing none, stand approved as read. Okay. Public discussion, comments on subjects under Board of Health jurisdiction not on the agenda. Is there something that's not on the agenda that, yes?
I'm not aware of the agenda, so this might be speaking out of turn, but is there anything about the plan for?
Come up here if you would. Here you can.
Sarah Hartman. I'm just curious if there was any discussion planned on the kind of rollout of the District 10 school reopening plan.
Go ahead.
I would like to get my mouth open enough and somebody can shut up enough so I can speak.
Just a second. Go ahead, Sarah.
Well, I guess I just want to say that we were really encouraged when we attended the school board meeting as parents. The plan looks to be really reasonable. However, a lot of it does hinge on, I guess, the number of cases or the, I guess, the community transmission piece. And so we just wanted to be sure that it went on record that there are a lot of us that would like to maybe have some clarification and some firming up of what that maybe looks like. We really strongly believe that kids need to be in school and that that jump from level 2 to level 3 is going to be really critical to so many families that are going to have to figure out the adjustments, and those of us who feel like we could just pull our kids out easily and homeschool them. We want to speak up for those that maybe aren't able to do that. So more just wanting to open up some questions and to let you know that we appreciate the planning and the working with the schools that you're doing, but that we really feel strongly that our kids need to be in school in as much face-to-face education as possible. Thank you.
Thank you.
Thank you for bringing that up, because I have been meeting quite closely several times with Randy Shipman and Gary Haverfield, and they feel strongly that they need to come to the Board of Health for review as well, and they would like to have that on the agenda in 2 weeks, I guess, if we can have the Board of Health again in 2 weeks, because it is such an important topic. So thank you.
Thank you.
Thanks. Okay, okay. Oh, George. You're sitting in the dark, George.
It was the only available space.
Go ahead.
George Warner. First of all, I am asthmatic, so I just wanted everybody to know that wearing this mask has been somewhat difficult. It's even worse when you're sitting than if you're working. But Mr. County Attorney, I agree wholeheartedly with your assessment of the governor's mandate. I couldn't have said it any better myself than how you delivered it. However, in regards to the Beaverhead County Health Board, City County Health Board, I still stand by my conviction that it does not have the autonomous authority that was granted under the statutes. And I am notifying you that I intend to challenge by appeal the decisions, not the wisdom that was utilized in decisions today, because I agree with the wisdom behind it. But I do not believe that the structure had been completed according to law appropriately, and subject to a form that you have for appeal. I will deliver a form of the appeal to the commission on Monday. Is that acceptable?
Deliver to who, George?
The commission.
You mean the county commission?
Yes, that's what I was going to do, unless you've got another suggestion. If you have another form or another way, I'll do that.
I mean, I don't, you can deliver it to the commission as the county attorney and the advisory of the commissioners. I would say they don't have the authority to overturn the Board of Health's decision.
I'm not asking them to. I'm just looking for a place to deliver the appeal so that they can advertise and we can conduct the appeal.
Well, that's what the district court is for, George.
No, it isn't. This is an available remedy that is in your bylaws. So if it's in your bylaws, it's got to be made available to the public. There's no reason to waste the district court's time if there's an available remedy that wouldn't do so.
I still don't understand why you're talking to the commission. If you want to appeal the Board of Health's decision, you give that to the Board of Health.
I stated that I am appealing the authority of the Board of Health to mandate these decisions. The rules that set this board up did not include that authority.
Yeah, I can't tell you what to do. If you want to deliver an appeal of the existence of the City County Health Board, you should deliver it to the
I
commission.
didn't say the existence. I said the existence among the authority to mandate. It's very specific in the document that created this, what authority they have.
It's very specific in statute what authority the health board has.
If we're going to debate it or not, the
And
first
that's-
step would be the available remedy of this appeal.
It's an appeal of what, George?
Their authority.
That's not an appeal.
Certainly.
It's an injunction against their authority to take action. That's in the
No, it
district
isn't.
court. Do what you like. Are you going to bring it to the commission?
Go ahead, bring it.
I will bring it to the commission and we can forward it to the health board, nurse, doctor, whomever.
Okay.
So my point is then you should just bring it to the health board, George. There's no point in bringing it to the county commission.
Okay, where would I take that? What?
To the health board.
To the health board. The next
This
meeting-
group right here.
The next meeting,
No, because the appeal would take place as soon as I make the appeal. So the bottom line is who do I deliver it to? Where's the evidence?
There's the chair of the health board right there.
bring it to me.
I will bring it to you.
Okay.
Thank you.
Okay.
I just wanted to make a statement. I've taken care of far more people this year at Redwood Funeral Home than I have any year that I've been here. The average number of people I've taken care of is about 75. I'm at 60. So, and 0 of them are COVID. I just want to let you know, and I don't know if that's something that I've had spouses of people tell me that they feel that it's because their loved ones are kind of cooped up and they're not able to get out around. I don't know what the solution is to that, but I do think that that's something that y'all should be aware of.
Thanks, Julie.
I have a question. You said 0 of them from COVID, how many of them from flu or pneumonia? Oh, you don't have a number?
I don't really know. I do know that there were a few in December that were unknown pneumonia.
Okay, thank you.
Okay. I heard the next regular meeting, 2 weeks out, is the 31st. Is that a work? Does that work too? July 31st?
I won't be here that day.
Okay. And then, under new business, is there anything that anybody wants to bring up that we have?
11 o'clock.
Pardon me?
11 o'clock to the meeting?
I assume. Yeah. We'll check the card on that.
Mr. Wright.
Yes. Who?
It's Ron.
State your
I
name.
just want to say,
Who is that?
thank you to everybody for their commitment, their compassion, and their emotion. And this only makes us stronger going forward. And most of all, the fact that we respect one another makes our community even more stronger than other communities. So thanks everyone there and the board.
Okay. All right. apologize for my twisted tongue when I got the boards and the stuff mixed up. And I'm glad everybody knows what I'm talking about, that I don't. Go ahead, Mike.
And I think Russ keeps forgetting to tell you, he keeps asking me for the packet and the agenda and all that. So talk to Russ or have Russ talk to you. He's not getting any emails. He's not getting any of the documents. So maybe check whatever email people are using.
I'll just, he goes for Cindy Decker, so I'll make a note of that.
Okay, thank you.
Correct. Thank you.
Okay, if no additional comments? Motion to adjourn?
Second.
Second, I got a second to adjourn the meeting. Thank you.